Today on the Eat to Live podcast.
I'm kind of a doctor who minimizes the use of this kind of testing and just says, what do you need to test it? Just do the right thing.
So you're dumping visceral fats, dumping fat into the bloodstream, which then is causing high cholesterol.
Yes.
And is that why high cholesterol and do high blood pressure go hand in hand?
It's true that taking high dose calcium supplements can increase calcifications in the joints and in the heart. And it's not a good thing.
Hey, Eat to Live listeners. I am here with my dad, Dr. Fuhrman.
And I'm here with my daughter, Jenna.
That's me. And today we are talking about how we could end heart disease. That's right. You wrote the book, The End of Heart Disease.
That's right. I did write a book called The End of Heart Disease. I forgot about that.
Catchy title, if you ask me.
I didn't even mention that when we were talking about this podcast.
Oh, you didn't? You wrote a whole book on this topic.
Yeah.
So
but we hardly ever talk about it.
Well, do you believe it? Do you feel like we really can end heart disease globally and in America? Because it is the number one killer.
Yes, it's so critical that people know this information. And I mentioned to you earlier last week that we have to do a podcast on heart disease to give people a more broader understanding of the underlying factors that cause heart disease, because people are in the dark. They still are very confused about this, and they don't know exactly what they can do to prevent themselves from having a heart attack.
To be fair, I feel like when people go to their doctors, a lot of the time the doctors just tell them what to do, give them prescriptions, and don't really educate them around the topic. Like, we're not getting a biology lesson on heart disease. And to be honest, I don't even think I know all the details. So I'm excited to dive in and really figure out what's going on in the body and why not only is heart disease the number one killer, but why is it still the number one killer with all these medical interventions, statin drugs, putting a stent in, triple bypass surgery. I know all these terms, but I don't understand all these things were invented, and is it really helping?
Hardly at all.
Hardly at all. Wow.
It shows you how misinformed the medical profession and the public is on the causes of heart disease. Mm-hmm. So we're living in the, in the dark ages of understanding this.
Totally.
Yet we have the information, so people, if they don't want to have a heart attack, they don't have to. The science is here.
This might be a spoiler. Yeah. But I have a feeling you're going to say drugs aren't the solution and instead lifestyle is. I don't want to ruin the whole episode, but...
Yes, I'm going to talk a lot about that.
Okay. So that probably is exactly what
we're going to talk about how green vegetables in particular are the most powerful medicine for your heart. And they have effects to stabilize the blood vessel wall, prevent inflammation, and prevent cholesterol penetrating into the vessel. And so, in other words, green vegetables are the most important medicinal foods to prevent future heart attacks. So that's, yes, one of the topics we're going to talk about today.
Okay, awesome. So I guess to kick it off, what is happening in the body? Why does someone face a heart attack? And what is medicine doing to stop it? But what actually is happening in the body?
You know, heart attacks, we should say, about 98% of heart attacks are caused by a clot that forms in the heart. A clot is a wound that's been healed up by platelets. In other words, if I cut myself with a knife and I hold a pressure on it, it'll seal itself up.
Right.
It'll seal itself because my body's going to form a clot to prevent myself from bleeding. Well, the blood vessels get broken on the inside. They get a little cut in them, and they have to be sealed up with a clot, and they seal the platelets clot to seal up the blood vessel, and that clot propagates and obstructs the vessel and causes a heart attack. So clots are the main cause of heart attacks.
Not just in the heart, but in the blood vessels in the whole body.
Well, it's in the heart, it would cause a heart attack. If the clot happened in the brain, it would cause a stroke. Okay. If it happened in the leg, it would cause it would cause something different in the leg. But
okay. So it's like in the arm. If it's a blood vessel, it's different than it's in the heart.
Yes, in the heart.
Right, that's the heart attack.
You'll cause death of the blood vessels in the heart. And that's why in an emergency situation, under threat of having a heart attack at the moment, rushing into an emergency room and running down the hallway on a gurney to have a stent put in and open that blocked vessel, open the clot up, could save heart muscle and prevent heart muscle damage. So I'm not saying that in an emergency situation, conventional medical care and rushing to put a balloon and a stent in doesn't have some life-saving effects. But that's only in an acute emergency, not if you're registering if you're signing up for something in your future, a week later, a couple days later. It's either necessary because it's an emergency or it's really not necessary.
When you say an emergency, are you saying someone who just had a heart attack or is about to have a heart attack? Is it either situation?
Well, it's called an acute coronary syndrome, is when the process of the clot starts to occur, and it could propagate and cause a heart attack, or you could be in the throes of a heart attack.
Right.
So in that process of having an acute coronary syndrome where a heart attack is happening, yes, we want to stop that, and then that's considered a medical emergency.
Okay.
You know.
So this is happening from a clot in the heart, and that's why a heart attack takes place. What do people mean when they talk about calcifications in the heart?
Well, first of all, the calcifications build up when you have old plaque. The older the plaque, see, the blood vessels start out by putting, and the first thing damage they get is you put fat on the body. And one of the sources of fat and visceral fat is cholesterol-laden plaque. The cholesterol plaque builds up on the exterior wall of the blood vessel and doesn't encroach on the lumen. And that cholesterol buildup, so here's a picture of a blood vessel, right? Here's a picture of a blood vessel that has the lumen not being, well, you can see that's open in the lumen where the blood can flow.
You're just calling lumen. That's the
lumen is the centerpiece, like the hose, the center open piece of the hose where it's red, where the blood flows. And then the yellow part is a cholesterol deposit that's external to the vessel wall, right? Now, this is called juvenile plaque or vulnerable plaque.
So I'm seeing some buildup there.
It's a lot of buildup, but it's called juvenile because it's young plaque.
Okay.
It's young because you see the yellow. It's not yet become calcified. Got it. Now, 10 years later, this plaque would become invaded by smooth muscle and calcifications, and it would become more obstructive. Now this is called obstructive plaque.
Because the hole's a lot smaller.
Yes. Do you notice that as
your blood pressure goes up? As
the plaque aged, it started to encroach on the lumen and interfere with blood flow, and it become more calcified and smooth muscle and calcifications and scar tissue. But as it become invaded, you can see that the separation between the lumen where the blood is flowing and the cholesterol soft part is separated by an isthmus of calcium and hard tissue. So it's the connection between the blood and the soft plaque that leads to a clot formation.
Right.
So these are older plaques that have become calcified, do not cause heart attacks. It's hard for this to cause, you can see the yellow can't get close to the red. Right. Because the plaque is old.
It's been calcified.
It's been calcified.
Okay.
So the more the plaque becomes calcified, the more protection you have against having a heart attack.
Wow.
You know.
How does that happen?
Over time, your blood vessel just ages, and the inflammatory nature of plaque leads to the deposit of calcifications. Okay. Now, this plaque is developing because of inflammation and deposition of fat. Cholesterol-laden plaque is a form of visceral fat, and your cholesterol plaque around your heart is proportional to the visceral fat on your body.
So I think we should talk about visceral fat, because I'm not sure everyone knows exactly what that is.
So I have one more picture I want to show you.
Yeah.
It's a picture of a person having a heart attack. It shows juvenile plaque, and now you can see there's a little fissure occurred down here, and the clot started to form, and this is a heart attack forming in a juvenile or young plaque. That's why when people go out on a binge and over Christmas, New Year's parties, they eat unhealthy, they gain weight, you put on some fat, you put on some early stage plaque, it's worse. Most heart attacks occur around the holidays when people gain weight because when you add more soft plaque to your heart, it's that soft plaque that allows the endothelial lining to be able to move, because blood vessels move in and out. So when they move in and out, and there's a lot of soft plaque right next to the vessel wall, that moving in and out could cause the vessel wall to crack and form a fissure or a cut and then expose the blood elements to the lipid core, causing a clot to form. So that's the cause of heart attacks.
Wow.
You know, now that explains why doing a stent does not lead to further lifespan, increasing lifespan, or reduction of future heart attacks. The reason why having an elective stent, the doctor does a angiogram, cardiac catheterization, versus a stress test, and there's a cardiac catheterization or angiogram. He sees where the blockages are in your heart. He says, "Oh, you've got 3 vessels that are blocked."
Okay, wait, sorry. You just listed like 3 tests.
Yeah.
So people can undergo multiple tests to look at the state of their body, their state of their blood vessels and heart health, right?
Well, let's say they first got a stress test or a coronary calcium score.
Okay.
And the stress test only becomes positive test if it's like I have an 80% blockage or more. And the coronary calcium score correlates with heart attack risk, but not so well, because don't forget, it's registering your burden of heart disease through your whole life by how much calcium built up over the last 30 years. And so that reflects the diet you've generally been eating the last 30 years. but it doesn't reflect the diet you're on now. It shows what you ate for the last 30 years. Once you had changed to a healthy diet and you're no longer at risk of having a heart attack, the calcium score doesn't go back to zero again. It doesn't go back to normal, but it doesn't mean you're going to be at risk because you have a high calcium score, because that's you're reflecting old, stable, obstructive plaque. It's the same reason why putting a balloon and putting a balloon in, balloon angioplasty and a stent in treating obstructive lesions that are causing lack of blood flow and chest pain doesn't lead to longer life, because you're treating parts of the heart that are not going to cause a heart attack. They're just going to give you more comfort and more, you're not going to get chest pain, you have more exercise tolerance, but it's not going to prevent future heart attacks because the stent does not address and treat those areas of the heart that are high risk of having a clot. Those are invisible to cardiac testing.
Are they?
Yeah, so you can do a coronary angiogram, which is a, they put the dye in your heart, and remember, it's only looking at the lumen. It only looks at the centerpiece. You're not seeing the...
I just want you to know, I have no experience with these testing. I've never had my heart tested. So angiogram, they put
the dye in, right?
Okay, they put dye in your heart, and they're tracking blood flow.
Well, the catheterization or an angiogram, they put the dye in your heart so they can get a picture of the blood flow in your heart, and they can see areas of the heart where the blood vessel has narrowed. And they can say, look, that narrowed blood vessel is 80%. You need a stent. You can have a heart attack.
Got it.
And that's already been, you could say, no longer paid for by insurance companies, for example. That's been disproven as being effective lifespan extender. Even though doctors do it to make money and and give patients comfort, it's not recommended because it doesn't make for a longer lifespan. It actually
can't predict where the clot's going to be.
It's not where the clot's going to be. And putting a stent, a foreign body in your heart, increases the propensity of the heart to throw a clot. Because now you have the edge of the stent becomes a nidus of inflammation to create more likely for a clot to form. And now the person has to be on blood thinning medications the rest of their life because you put a foreign body in their heart. And the blood thinning medications, then reducing the risk of clots, then increases the risk of hemorrhagic stroke forever. So you took a mild risk and turned it into a greater risk by putting a stent in.
However, you did mention, so this can hurt you if you don't need it, but if it needed a life-saving measure in that moment, it could be helpful.
It could be life-saving in an emergency situation.
Right. But these are the situations where it's not emergency.
Most stents are not placed for emergency situations.
Understood.
And even now they upcode tremendously. You know what that means, upcoding?
No.
Insurance companies won't pay for just a stent electively. They only pay for it when it's an emergency. Mm-hmm. It hasn't been proven to be benefits when you do it electively.
So that is the same guidelines that you're giving as well.
The upcoding means they write down it was an acute coronary syndrome. The doctor codes it to make it look like it's an emergency. Mm-hmm. So the insurance company will pay for it.
Right. But you're saying it's actually a bad thing. No one should get that unless it's an emergency situation.
Correct. That's exactly what I'm saying.
Okay.
And so you were asking me about
calcifications.
The calcifications.
Well, no, because I have so many questions on all the things that contribute to heart disease, because I feel like there's many facets.
Yeah.
So back to calcifications, please educate me.
Well, we're saying that the calcium invasion to the abnormal lipid deposits in your heart is protective. It leads to more stabilization of the plaque. We want to remove the fatty plaques, and we can't take out the calcified plaques. We can reduce them very slightly over time, but that's not where our focus should be. Our focus should be stabilizing plaque so it doesn't rupture. And even putting on statin drugs and dropping LDL extremely can have the effect to actually increase the calcium score, not decrease it, which could be a good thing as the plaques would become more stabilized with more calcium invasion in the tissue, in the artery wall. All right.
Following up on calcifications just at a higher level so that I can understand, we're not talking about dietary calcium, or it is excess calcium from our diet, or how do these calcifications form? Can you explain that? Because it's both calcium.
Yes. It's true that taking high dose calcium supplements can increase calcifications in the joints and in the heart. And it's not a good thing.
Okay.
If you want to increase your calcium a little bit, take a little bit with each meal. Don't take a high pill. Don't take 1,000, 1,500 at one time to protect your bones. It's too much of a flood of calcium in your blood at one time that could accelerate calcifications in your heart.
Because you put a small amount of calcium in your multivitamin because you want people to get the optimal amount. So you think we're not getting enough from diet, but too much taken in supplemental form, not with meals, can increase your risk of calcifications in the heart or body.
Right. I also give women a supplement called Osteobiotech, which gives a small amount of food-grade calcium with meals, absorb very slowly with a small amount of extra calcium, because their dietary intake of high calcium foods isn't sufficient to optimize their bone mass.
Got it.
So we give them a little extra calcium, but it's not hurtful for the heart because we're not giving them a huge spike of calcium.
It is hard though. Like you don't want to be fearful of calcium because it could cause a lot of problems if you're deficient, but then you're saying too much can cause actually systemic problems in the body.
Yeah, but I'm also saying calcifications in the heart are not a major cause of heart disease anyway.
Oh.
They're not the major cause of heart disease. And I was explaining that the calcification has some protective effects at stabilizing the blood vessel wall from rupture.
It's the young plaque.
The young plaque becomes older and more calcified. It becomes stabilized.
Mm-hmm. But it's the young plaque that is more of a risk of a heart attack.
Yes, it's the newly laid down plaque. The diet you ate the last 6 months determines your risk of heart attack, not the diet you ate the last 6 years as much. So because it's the newly laid down plaque that's most dangerous, not the old stuff that's as dangerous.
I'm getting excited.
And that's good because when you change your diet, you reduce your risk by 99%. Your risk drops by almost 100%, even if you ate badly when you were younger, because your risk is proportional to the diet you're eating now, not the diet you ate for the last 30 years.
And that's where you're saying these tests aren't that helpful because it needs to be looked at so current, not the diet that you've been eating the past 1 to 3 months. It needs to be what you're doing now.
Well, there is a test called a coronary artery CT scan that can look at heterogeneous and visceral and plaque in the heart and can be more accurate than a cardiac calcium score or an angiogram. It's more exposes you to radiation, and it's a more expensive test. And what's the purpose? I mean, you see a person at high risk, but there is some data to suggest when people see they're at such high risk and they have vulnerable plaque, it induces some people to make more radical lifestyle change that can help them. You don't need, I'm kind of a doctor who minimizes the use of this kind of testing and just says, what do you need to test it? Just do the right thing. You know?
Totally. Like lower your risk.
But if you're not going to make a change unless I can convince you something's wrong, then maybe do the test. But the major problem I see here, why people still having heart attacks, is because they think because they're taking blood pressure medications and they're taking a statin to lower their cholesterol and they have low cholesterol and they think they're now protected because their cholesterol is low, and they're not. It's this falsity that they think that the LDL cholesterol is favorable, they're not going to have a heart attack. That's what's killing everybody of a heart attack. Because for many people taking a statin drug with the cholesterol being favorable, it's like a permission slip and they think it's okay to eat whatever they want. And because the cholesterol looks low, they think they're okay.
I feel like you say this about everything, really. Drugs show you lower numbers and give you a false sense of security that isn't really happening in the body. Is that exactly what you're saying?
Yes. Because let's talk about the cause of those clots in the heart. We're talking about it's mostly caused by inflammation in the wall of the blood vessel that causes it to open up and form a clot. And lowering the LDL cholesterol could reduce the degree of lipid buildup into the wall, but you're going to get invasion of lipids going into the wall, even with a low cholesterol, when you have more inflammation and when you have more lipokines or adiptokines. The adiptokines that are coming off the fat supply it's poison.
Are you making up these words?
Yeah, making them up.
Lipokines and
cytokines, lipokines, adiptokines, but it's the adiptokines.
Are you making them up?
No, I'm not making it up.
Okay, sorry. Okay, sorry. Okay. Liptokine. All right, tell me about the kinds. Is this fat?
No, just talk about adiptokines.
Okay, adiptokines.
Just one kind.
Okay. Just one kind of adiptokines.
Now, here's what I'm saying to people. I'm saying your body fat, particularly your visceral fat, is not just fuel on your body. It's dangerous metabolically active tissue. Your body fat is secreting poisons into your bloodstream and causing heart disease. Mm-hmm. And a lot of people eating like vegan diets or healthy diets, if they're still fat on the body, they're at risk of having a heart attack. Fat on the body causes heart attack because fat is dousing your blood vessel, the endothelial lining, with adiptokines, which inflame the wall and drive cholesterol through the wall of the blood vessels into the plaque, drive the production of plaque.
Okay, tell me if I'm right here. So visceral fat is the fat outlining your organs. So it's the fat in the body that can be causing blockages or this or that. Is that true?
Yes, you have two types of fat: subcutaneous fat that you can pinch around outside of your abdominal wall, and you have the visceral fat that's internal into your organs, that's around your heart, around your liver, around your kidney, and the visceral fat also is dumping lipids, or it's into the bloodstream, into the portal blood flow around the liver, which produces more cholesterol too.
So you're dumping visceral fats, dumping fat into the bloodstream, which then is causing high cholesterol.
Yes.
And is that why high cholesterol and like do high blood pressure go hand in hand? Because it's like I figure like.
Here's what I'm saying. I'm saying if you take a statin drug to lower your cholesterol, you're still dumping adiptokines into the bloodstream. You're still having inflammation.
Yeah.
You still have oxidized LDL. It's just lowering one of the 10 risks. And because you lowered 1 10 risks, you're not going to have a heart attack. As a matter of fact, if you think you're getting so protection from that super low LDL, you're probably going to be worse off because you think you can cheat more with your diet. And then you're going to have a heart attack.
Right, like thinking, oh, my drugs have me covered. That's
I'm covered.
Why I'm
my blood pressure's
them.
good. My cholesterol's okay now. I can just go have a steak.
Totally. Like I got my high cholesterol in check so I can keep eating that LDL and saturated fat.
Right. And look at the new guidelines by the jerks running our government.
You love them.
That say that, we might as well just eat more red meat and beef tallow and full fat dairy. So when you eat saturated fat from animal products, it gets even worse. Because the saturated fat from animal products causes more lipemia, more flow in the blood. The fat in the blood remains there longer when it's saturated. It hangs out longer, and it's able to cause more inflammation and damage to blood vessels.
I do feel like they're saying now that saturated fat isn't bad for you. They're like, saturated fat, eat it. Eat your full fat dairy, eat your beef, eat your... Yeah. You're saying that's definitely wrong.
Well, it became that way because they had so much donations from the industry, and they had 6 people on the board who worked for the
I heard 7 out of 8 meat and dairy industry.
Meat and dairy industry
on the board
doing the guidelines. And when we went, we picked 5 people who the U.S. government contacted me and my buddies, and they asked me for 5 people who would be advisors to the U.S. government for the new dietary guidelines. And I put together a team of me and 4 other people. Great team. I don't have to mention the names. And they decided not to go with us, and they told us, because we have too much accepted donations and political pressure from the meat and dairy industry. So they're not going to go with plant-based
advocates, scientists, nutritional researchers.
Right. I picked the head of the NIH, the head researcher at the NIH. I picked the head person in lifestyle medicine. I picked all the top heads in the world, scientists and nutritional scientists in the world, and they decided not to go with this, and because they wanted to be more politically accessible. You know, I made a joke when I was in Vegas doing my comedy routine.
You do.
I made the joke. I said, "Oh, Trump's going to put Oscar Mayer, pastrami, and hot dogs at the base of the pyramid because they just put a big donation into his pack." So I was making a joke, but it came to pass. It was like, it's true, So we have a
no. That really is so depressing because if there was such a point in time where they could have made real change and actually got behind science and like this life-saving information that we've been so wronged and it's been withheld from us for the last 20 years. And they had a chance and they totally just went money.
It always goes money.
Yeah. It's crazy. It's so sad.
Yeah.
That's why listen to our podcast. We're giving it to you for free.
It always goes to the money.
Well, yeah. And I feel like, not to get too political, but I feel like you did have hope that Robert RFK Jr. did care about health and was going to make some positive changes, at least in the health side.
Right, and my connection to RFK, that's what put this connection together, But it failed because it failed.
Big time. I mean, it's like hearing that saturated fat and eat your full fat dairy and meat is so devastating because you know what? It impacts the world in the sense like the coffee shop I went to this morning, they offer oat milk and they offer whole milk. That's it. So like people really do listen and now they're like, oh, I don't need skim milk products, which you shouldn't have your dairy in general, but they do listen to trends, guidelines, information, things that get attention in news.
Eating fat makes a difference. And having fat on your own body makes a difference. You can't be protected against heart disease unless you control your caloric window. You not only have to eat the right foods, but you can't overeat and not exercise. Everybody overeats. And as you know, we teach people they overeat because of the caloric rush, because they're eating foods that drive food addiction.
And not meeting their nutrient needs.
But everybody's overweight. And, so it's a combination of eating the right foods and having these medicinal foods that prevent inflammation and also having a low body fat and low visceral fat at the same time.
This is kind of on my mind just because I've seen this. someone looks like very thin, but their visceral fat is, kind of high. And we test visceral fat on our InBody machine at Longevity RX. So we're able to see a level that the InBody generates of the fat outlining your organs. So would you be wary of someone who looks thin and is active, but has a higher visceral fat number?
Yes. Most people who don't look overweight, a lot of them still have high visceral fat.
Right.
And
so
the
that's
body
still
fats,
a danger.
And they don't look overweight, but they have body fats. Males with body fats 20%, females with body fats, 33% body fat, and they don't look that heavy, but they have so much fat on their body, and they're not worried about it because they look like everybody else and they feel okay, but it's still a risk. So the doctors are making them think like, okay, your blood pressure's okay, your LDL cholesterol's okay, nothing to worry about. But that's not true.
Right.
If you have high visceral fat, it's something to worry about. Plus the fact that it's oxidized LDL. That's the bad actor. Not total LDL as much. And you can push your total LDL down with a statin drug, but the percent of LDL that's oxidized could still be high. And when you eat a nutritarian diet, you have so many antioxidants and phytochemicals that it makes the oxidized LDL become very low, which means there's anti-inflammatory. And plus the fact we're eating foods that contain nutrients that activate nitric oxide production in the endothelial wall, which actually has a soothing, vasodilating, and protective effect on the blood vessel wall. You're supposed to have active and continuous nitric oxide production, and the most powerful foods to activate continuous nitric oxide production are green vegetables. Now, let me ask you a question.
Please.
If you took a green smoothie, or had you chew a salad up, which would activate nitric oxide more, the green smoothie or the salad?
This is so easy because it's just what you talk about all the time, not related to heart health, but I'm going to give it my best shot. When you chew really well, you activate compounds in the saliva and throughout your body that helps something good.
That's right. When you chew it, the saliva mixes with the bacteria in the mouth, and it produces more nitric oxide production when you chew the food up.
Wow.
So yeah, and you produce more endothelial growth factors.
So there are definite benefits to eating a salad crunch, crunch, crunch rather than smoothie. Because smoothie, you think it's easy, it's broken down
than
for
nothing,
you. Right.
But it's not the same thing as eating a big salad if you're really chewing it well.
Yeah. Okay. So chew your food.
That's
people.
like the number one nutrition prescription I give people is to make that daily big salad with the sprouts in it and both the lettuce and the arugula or the kale, and to put a nut-based dressing and to chew it really well. Right.
Okay. So while you're empowering us with all this information, I just want to be clear. So we're talking about cholesterol. There's two types. There's LDL and there's...
Well, there's a total cholesterol, and then it's made up of various other small particles. But LDL and HDL, and there's VDL, there's other particles too. But the main ones are HDL and LDL.
But people think LDL is the culprit contributing to their heart disease.
LDL is the bad guy, and HDL is the good guy.
Okay.
That's correct.
Got it.
And so we want to keep HDL higher and LDL lower.
Okay. So, and LDL is what they treat through drugs, or there's also supplements and good supplemental ingredients that could lower LDL. Is that true?
Yes.
Okay. Like yours is LDL Biotech. Do you have a product?
Right. Our LDL Biotech contains 5 different types of ingredients. Plant sterols that lower LDL cholesterol. Right. It contains the punicagninins from pomegranate, right, that act like natural nitric oxide producers and lower inflammation and have like an ACE inhibitor, relaxation effects in the blood pressure and lower blood pressure. It has amla, which lowers cholesterol and reduces inflammation in the heart and lowers blood glucose.
Amla's a fruit, right?
It's like a fruit. And then it has the chokeberry too, which has the rich source of these polyphenols that have anti-heart that lower oxidized LDL. So yes, we have a supplement, but of course, I'm giving everything in the context of an excellent diet. You know what I mean?
Totally. Like this is an extra booster for someone who might have a genetic predisposition or is overcoming heart disease. You give them an extra boost because these are good ingredients.
And because I don't want them to take the statin drugs.
Right. I was going to say
because the statin drugs can cause weight gain. It can cause side effects. It can cause it can cause more insulin resistance. We didn't talk about the reason people taking statin drugs think they're protected and they don't protect is because of insulin resistance causing spike of glucose into the blood with insulin resistance and more body fat activity, which then leads to smaller, denser LDL particles, which are more atherogenic. They produce.
What does that mean?
Produces more atherosclerosis.
Okay.
You actually build more plaque from these small particles that are produced by eating sugar and white flour and honey and maple syrup and white potato and white rice. Now, especially when you eat naked carbs.
Naked carbs.
Right. So we're talking about eating, saturated fat and a fatty food causing the lipid tide in the blood, right? That's bad for you. And the sugar tide in the blood is also bad for you. Both those things cause heart disease. And we're referring to naked carbs.
You're not against being naked. You're just against naked carbs.
Correct.
Got it.
Skin.
Nudist.
Yeah. I did the immortal chamber this morning.
Oh, you did?
Yeah, I was in the red light therapy, naked in the chamber.
Yeah.
Yeah. I don't know what it's doing for me, but it's fun. I mean, it feels good.
It's actually supposed to make you more beautiful.
Really?
Yeah, red light therapy is great for your skin.
Oh, good.
And did you find the meditation and acoustics nice?
Oh, yeah.
Yeah. It's honestly, I've been really getting into, this is such a side topic, but I've been getting really into saunaing plus the immortal chamber. Immortal chamber, I love that red light, but the sauna also, they say, helps prevent dementia and increases brain circulation.
You can do saunas that have red light therapy in the sauna too.
Yeah. So I guess, cool. All of it. I mean, I'm into all of these longevity chambers.
But we're going off the topic.
Yeah.
I can keep talking about that, but it's off the topic.
Yeah. Okay. Wait. No.
Yeah. So what are we talking about here?
Wait, we were talking about naked carbs.
Naked carbs, right.
You brought up being naked.
Because let's say, what makes a naked carb more dangerous? Because if you have let's say you're eating a potato or a roll, a white,
butter.
Well, if you have it with green vegetables and a salad and some beans and nuts, it's not naked. You covered it with enough foods to prevent the long-term glucose spike.
Right.
But if you just had some French fries, or some pasta and bread or some big, or just 3 potatoes, you didn't have it with the green vegetables and the beans and the nuts. It's called naked carbs.
Okay.
So it's the ratio. So when we're trying to give people at night, they want to make their plate at night, half the size of their plate should be green vegetables at night, their dinner.
That's what I was going to say. Does it have to be like a cheese pizza versus a vegetable pizza, or can you have like a salad before you have a pizza and that would make it not naked? Like if it's in the same meal, does that make it clothed?
Yes, but of course, it's the amount of naked carbs. I don't recommend pizza that has made from white flour because you have an overwhelming amount of salt and white flour in there.
Right.
A little bit of, we're talking about, we're having carbs from a little sweet potato or a little bit, quinoa or whatever. We're not using too much white flour, and especially only a special occasion.
Yeah.
But even then, it's not naked.
Right. Well, I'm just thinking like if you're making your at-home pizza, you can make it on a pita, on your own crust, on a cauliflower crust,
whole
whatever.
Wheat pita or
but loading up on vegetables, like adding a lot of mushrooms and arugula or whatever you add on top of your pizza could make a difference.
That's the key to a vegetarian diet, right?
Wow.
Yeah.
What's the key? Tell me the ultimate key.
Well, the factors are nutrient density and diversity in the tissues, right? Lack of toxicity, which is affected by the high level of nutrients, brings down the toxicity. Low body fat percent. You can't get away. You can't be healthy when you're overweight. There's no such thing as a healthy overweight person. That's just a myth. People just fool themselves. And the last thing is the omega-3 index. And the omega-3 index plays a huge role to play in heart disease risk as well. In the analysis of the Framingham study, the 2024-2025 reanalysis of the data in the Framingham study, it showed that having an omega-3 index most favorable, above 8, had a 90% reduced risk of cardiovascular death compared to an omega-3 index below 4.
Wow.
And that the reduction in risk was comparable to a person smoking a pack a day of cigarettes. So the omega-3 index is a major factor when you ask those factors that we're in control, right? Of
in
these
heart health even.
Even in heart health, yes.
Wow, because omega-3 index, I mean, you hear all the time that it's brain health.
We're talking about brain health and dementia. Nutritarians who are eating so healthfully, we want them not to be vegetarians and not to shrink brain because they're not at risk of heart disease because they're slim and eating healthy foods. They're still at risk of brain shrinkage if they're not high omega-3 index. But these people are at risk of heart disease. If their omega-3 index is low, they're going to dramatically increase the risk of heart disease.
Is that because it's like good fat that helps displace the bad fat? Is that how that's working?
No, it has anti-inflammatory effects on the endothelial lining of blood vessels.
So it's that anti-inflammatory. You want to be slimmer?
Heart disease is an inflammatory disease of the endothelial lining of your heart. And you could have the lowest cholesterol in the world, but if you have inflammation going on the interior lining of your blood vessels, you're going to have a heart attack.
Right. And inflammation is caused by extra visceral fat. You're having more lipids dumped in. I'm like creating
you're not getting enough of the phytochemicals and antioxidants in the foods, particularly green vegetables. We are a green vegetable dependent animal. And we've been alluding to that the whole time we're talking on this podcast, that half of our diet should be green vegetables, both raw and cooked.
Totally.
Every meal is an opportunity to get more green vegetables into you.
Can't berries and fruit also help with heart health?
Yes.
Because it's so high in antioxidants?
Correct. And nuts and seeds help too.
Oh, yeah. Nuts and seeds melt heart disease. I feel like we've done a whole podcast on that.
Yeah, we did. It's amazing that people who eat more than an ounce of nuts and seeds a day have a tremendously lower risk of heart attacks. All the studies show the same thing.
Right.
It's amazing. There's almost...
And cancer. And like, that's the thing is what you say over and over and over is that these foods that fix one problem fix, all the problems.
Right.
Heart disease, cancer.
The underlying message today is that we are in control of your health destiny, and you don't have to have a heart attack if you don't want to. You can control that. Doesn't mean there aren't rare cases in human history where a healthy eater can't have a heart attack, but that's exceedingly rare. And it's usually some genetic reason that's of an unusual genetic reason, but it's almost always the case that that person that you think is eating healthfully is still overweight. Mm-hmm. They're still overeating and still have too much body fat on their body.
Mm-hmm. Yeah, so it's possible that genetics play a role, but also our diet and lifestyle can impact it enough where you don't have to be susceptible to that.
Right.
Which is really important.
And we have to control our caloric window, which means your window might be the amount of calories you should be consuming your life, most of your life, should be between 1,200 and 1,400 calories a day. Mm-hmm. Maybe my window should be 1,600 to 1,800 calories a day. I know my window, but if your window is that and my window is this, if I go out of that window, I'll gain weight. Now, the nutritarian diet helps us lose weight because it makes us satisfied to live within our window. If you're eating unhealthily, you're not satisfied living within your window. You got to have more food because you're not going to feel your needs aren't met. So the nutritarian diet doesn't solve your weight problems unless you use it to stay within your caloric window. You know? Well,
I will say on that front, it does kind of solve it. I at least feel it personally, because when you nutrient overload, I like to talk about this. When you hit a lot of nutrients and are getting a lot of antioxidants by eating a lot of fruits and vegetables, it shuts off your appetite and makes you not hungry. I do feel it when I eat a lot of vegetables. I'm like, no more, but like you don't want it. And I think the way you listen and it changes your mind and body is really amazing if you pay attention.
It's amazing that you don't need that many calories when you're eating really healthily.
I believe that.
You feel satisfied.
And the volume might be big, but the calories are very small.
Like I had this lunch today. I didn't eat that many calories. I had a big salad with soybeans in it, and I had pomegranates in it, and I had goji berries in it, and I had an onion, a really big salad, and then I had with a nut and seed-based dressing. And I had one orange, and I think I had one artichoke, and that was it. I was satisfied.
I had some artichokes last night for dinner. I came over and stole yours, and they were delicious. I had 3. Is that too many?
3 halves.
Yeah.
No, they're super good for you.
Yeah. No, but it made me full. This is what I'm saying. Yeah. Okay. I want to share this one story because I think it's really, really a big takeaway for everything that you teach about heart health. And it's so against what the normal population thinks. But you had a patient that came to live with us because he was a guest at the retreat. Mm-hmm. And he had just had a heart attack. So he was in the hospital, and his brother had been a guest with us before and stayed with you. And he said, don't get the surgery that
Don't get the stent. They wanted to put a stent in.
They wanted to put a stent in.
He came from Nashville and flew out to California and did not put the stent in.
When he was, after he had a post heart attack, is that right?
It wasn't, they were going to put it in electively after the small heart attack.
Okay. Yeah. So he was going to get a stent in, and his brother said, don't, just go to Dr. Fuhrman's retreat. So he comes to your retreat, and everyone in the house was frantic because they heard this guy had just had a heart attack.
He was a doctor.
Yeah, he was a doctor.
A medical doctor.
Yep. And you had to explain that you don't need to worry anymore because this is the safest place for him. So can you explain your thoughts behind that? Because people were frantic that this guy who just had a heart attack could he have another? Right. If he didn't get the stent.
Right. Placing the stent would have not lowered his risk of heart attack, could have increased his risk of heart attack, and does increase risk of heart attack, But we can immediately diffuse the risk by having him eat a strict diet and dropping visceral fat and flooding his body with nutrients. Mm-hmm. So you bring up a good point. Let me make this point clear. If you are gaining visceral fat, you're at risk. But if you're in the process of losing visceral fat, your risk goes down tremendously and quickly. Mm-hmm. That's why people going through gastric bypass, their diabetes goes away and the risk of having a cardiac event drops, even though they're still overweight, because they dropped 30 pounds the first month. That while your weight is dropping aggressively, your body is stabilizing the endothelial lining from rupturing. Mm-hmm. So for some reason, putting the fat on increases the inflammatory potential to form a platelet clot, and taking the fat off decreases the potential of forming a platelet clot. So, and the food itself decreases the propensity of a clot to form, right? So we're talking about anti-clot forming effect of what we're feeding him too.
And because I remember you kept saying, which really impacted me, this is the safest place for him. And so you were confident, which it's really nice to know that if you make these changes, they affect you immediately. There's no waiting time. You can actually
within a month, for a person who couldn't walk half a block, he was hiking up the mountains and back in great shape again.
Yeah.
Right.
I mean, I love the people that stayed with us because I knew them personally, and their stories really do stay with you, which is amazing. But you mentioned that it was strict once he followed a strict diet. And I do feel like it's not even a strict diet. It's just the right diet. Like just eat.
Yeah. We don't think we eat strict diets, even though compared to most people they are.
Yeah.
We're just eating what we feel like eating. We've acclimated to ourselves to feeling best and enjoying life more when we eat the right diet. And
I think we really have a different idea of what food is. Like I really think innately it's your belief system, and we believe that like the nutritarian diet are like the only foods to eat, really. Like when I'm at the fair, I don't see funnel cake. Like now, I mean, as a kid, it was quite different, but like now I really don't see it as anything I want to take part in or even as food, because I started to associate the way it makes my body feel. And you can, when you eat so clean, your body really feels it and feels the difference if you then turn. And so just that word strict, I'm like, it's not strict. It's just the right foods that fuel lifelong health.
And your exercise tolerance is always there. And your play span and your ability to do things and be active, and so it's tremendously rewarding to eat this way. Yeah.
So, I mean, when you're talking about the end of heart disease, you know that stress management and exercise all plays a role, sure, but you're saying the number one impact is obviously the food.
Absolutely. And I'm also saying that don't think you're protected because you're on drugs for blood pressure lowering and cholesterol lowering, and your numbers look good because you're not protected. If you're still salting your food and you're on blood pressure medication, you're still damaging the interior lining of your blood vessels from the salt, whether your blood pressure is registering the damage or not. And if your cholesterol is low with a statin drug, you're still damaging the endothelial lining of your blood vessels, whether your LDL cholesterol is high or not. You're covering up you're not seeing the effects of the diet because you covered up with a drug, but the damage is still occurring. And that's the major message here, is that people taking drugs to make their numbers look good, they're still having heart attacks, still the number one cause of death, and they still die on the drugs.
Right. So, but you are saying we do have the power through food. You would say you have the power to not have to worry about heart disease or heart attacks.
Correct.
That's amazing.
Yeah.
And what would you say to the people that say something like, I know what I should do, I just can't do it?
Well, I mean, I don't know. I mean, we're all free, and people should do whatever they want to do. I'm not into controlling other people, and they can take their own risks. Some people may feel, I'd rather die 15 years younger and be able to eat anything I want. Well, that's your right. I'd rather live 15 years longer. And because I learned to enjoy healthy food, and I got great recipes, and the myth is they think they're enjoying their life more eating risky foods, and they're really not, because we develop a taste for it and have great recipes and enjoying our, But
I know,
so I don't know. People have a right to smoke cigarettes or to drink alcohol, right?
But I think I feel like families should get behind this person and start all supporting each other by making little positive changes that could actually make a big impact. So I think even though they say that, like little changes can really yield a big result. And I remember another person that we worked with who said that the first month they stayed with us, they said that they would just rather die younger, but they were there. So you knew they didn't really mean it. And then the second month, they were like, okay, no, I'm changing everything. It just took me a while to mourn and to kind of let your mind get there.
Right. There's like a mourning period of like giving up these things.
Yeah.
And then your taste buds get stronger and you start to enjoy all the flavors of natural foods more. And you realize, what was I thinking of?
Totally. And then you realize you're out of pain and you could actually move around and you could actually do things. And wait, this actually isn't so bad after all.
Right.
So it's pretty miraculous what you set your mind to, the amount of changes you can make in your daily habits.
Absolutely. But it's up to people. They have the freedom to do whatever they want.
Well, the good part is you're getting them the correct information. And I feel like the biggest red flag is to say, do not listen to the new food pyramid.
That's my point all along. My whole life I've been saying, well, do whatever you want to do, but at least know the right information.
Totally.
Because you're making decisions on the wrong information. That's what I'm objecting to. I couldn't get the right information out there,
Well, if the board who even made the new food pyramid, at least you have your list. Maybe you should start your own council and actually get a proper food pyramid out there. That would be great.
Yeah.
Oh, you're retiring, but yeah.
Okay.
Just listen to the podcast then.
Okay. All right.
Well,
We'll wrap this
Dad,
up.
I know that you wanted to do this episode just to hang out with me as your middle daughter. So that was a really nice hour we spent. And that was a biology lesson, or physiology.
Yes. And it's good information for people to hear.
Absolutely. So thanks for it. And now I'm going to challenge you to high-fiving me with your foot.
With my foot?
Yeah. Nice. Okay. Thanks for joining us. We will see you next time.
Bye-bye.
Dr. Fuhrman, always a pleasure.